Why should I go see a doctor if I feel healthy?
What chronic conditions should I get screened for?
Why is it important to have a primary care doctor?
What would happen to my body if I don't manage my diabetes correctly?
You're done.
I think that we are so committed to give care to our patients and to our loved ones that we basically don't take good care of ourselves. About a third of our members consume the larger share of all the expenses of the benefit fund. I think it's incredibly crucial that we spend time to reduce our weight so we have proper weight, that we exercise, that we eat well.
Currently, we are in the midst of an epidemic of obesity. It is a chronic condition leading to many other chronic conditions such as diabetes, hypertension, cholesterol problems.
Nearly half of our members think that they could use some help with keeping their weight under control. And in fact, it wasn't just their own opinion of whether they were overweight. Many of them told us that their doctors had told them that they need to lose weight as well. People end up feeling like there's a miracle cure out there and it comes in a bottle and it's a little blue or green or orange or whatever pill. And unfortunately, it's often the kind of thing that it will address a symptom and will mask a deeper underlying problem.
I've been eating this way for years. Would changing my eating habits make a difference?
Is it going to make a difference if I'm going to start dieting right now?
It's never late to start eating right. There is never a wrong time or wrong moment to start. Small changes are important and they all add up. Start gradually and don't go for quick diets and quick fixes. They do not work.
You did not gain that weight overnight. Don't try to get it off overnight. I mean, it's slowly. If you are going down 1-2 pounds a month, that's okay. What's important is for you to stay close to your ideal body weight. And we're going to work together toward that goal.
Told me that, to eat healthy food, a little bit of exercise, and keep active. My goals are to avoid these heart disease and diabetes, so that's why I started doing exercise and eating right. So instead of eating McDonald's, I try eating a salad or a fruit plate. Instead of eating fried food, I eat, baked food. I try to take 5 minutes of walking and, the rest, try to take the stairs instead of the elevator. Whatever that I could do, I do.
How do I know what's good for me to eat and what's bad for me to eat?
It's essential to stay away from fatty foods. Try to bake, broil, steam, poach, stir fry, but avoid the fried foods. Avoid the animal fats, red meats. Milk products have to be low fat. Also try to have a balance in your daily intake. Vegetables, fruits, fiber, very, very important.
But also together with the changes in your eating habits come the most important part, and it's exercise.
I'm really busy between work and family. How do I make time to exercise?
If I don't have time to go to a gym or can't afford to go to a gym because it's too expensive, how do I do some exercise?
Exercises don't have to happen in the gym. You can do it at home. You can dance. You can do gardening, etc. When you are at work, take stairs instead of elevators.
I usually recommend to my patients, go out and walk. You don't have to be in a gym. You just go out and walk for 10-15 minutes and that will be sufficient.
Many people tell me that they have knee pains and lots of other reasons not to exercise. Those are all excuses. You can do chair exercises. You can sit in a chair and do a lot of aerobic exercises that will be great for your heart, as well as toning up of your muscles, and weight loss. You'll lose some calories.
Well, I started to eat healthy and as much as possible exercise on my breaks, you know. I walk about like 10-15 minutes in the hospital, around the hospital.
I take a jump rope, I try to skip a little bit at home, and I don't really have to go to a gym. I'm very proud of what I'm doing right now with the basic, and it's really keeping me healthy. And I'm feeling good about myself.
Oh yes, I've lost 20 pounds. I've attended the wellness center at Maimonides Medical Center. Now I'm not using as much fat, so I'm really cooking different, I'm eating different, I'm doing things a lot different than I would normally do.
It's never late to change the way that you eat. It's never late to start exercising. It doesn't require too much.
Small things add up, and you will definitely see the dividends in good health.
So remember, your benefit fund is here for you. We want to know how to be your partner in protecting your health.